from BDS. So then I saw physiotherapy. I know that it has created a great change in my mother's life. So I thought, okay, why not try that?
Oh, so you got the seat of BDS, but yet
Yeah,
you changed your
I
mind to.
tuned. Yeah.
Wow, that's great. That's great. But it's more like get together.
Yeah, it's
you
fun.
guys can enjoy fun,
Yeah.
and culturals will be there,
Yeah.
and so on. So
One more important thing that everybody needs to remember is research involves a lot of people. You cannot do alone. No, you do alone, you restrict perspectives. You have many people as in not really many. You have 2-3 people, they give you perspectives. So that will make the study even more better.
for that we need to select correct people.
That's true. I actually don't remember what was my topic.
Okay, it's fine. We'll decide that.
Yeah.
Abhi will put it over here, guys, somewhere.
It'll come down. I don't remember.
Hi guys, welcome back to another episode of Physio Educator. In today's topic, we're going to be discussing something which is very new and definitely you guys will like it because the topic of the day is about community physiotherapy. And I do know many of us doesn't know about this career earlier, even for me, because when she joined in one of my classes, when we were talking, when she said that I'm a community physiotherapist, I was like, what was that? Okay, so now she is in my podcast as a guest. So we will discuss about community physiotherapy, very explanatory and very elaboratory as well. So hi Aishwarya,
Hi, Anu.
how are you?
I'm good. How are you?
I'm doing great as well. So how do you feel after long struggle of texting back and forth
Yeah,
about
true.
coming to the podcast? Because you were truly busy with moving in one place to the other, one place to the other. So how do you feel? Feeling calm?
Yeah, I am. So yeah, like you told, no, we were talking about this from a long time. So even I wanted to do this. Like people need to know what is this. So a career in community physiotherapy, it is budding. So people need to come more into this. So at least 100 physios who are studying, at least one person comes into this will make a great impact on the society with interest. That's more important. So they come with interest is going to create a different impact on the society. So I wanted to do this. Thanks for the opportunity.
It's fine. We have to be very, very, very happy to have you as a guest as well.
My pleasure.
So we'll start. So the very first scenario, like how you joined physiotherapy, what made you to join physiotherapy?
So like every other person, medical field was something that I really wanted. I have always been thinking about service when I think about a career in life. So this started very young. Like I don't even remember when, but if I have to actually trace back, probably when I was in 5th standard or something. So service was something that I really wanted to do. So I always thought about not having a 9-to-5 job, but actually creating an impact in people's life. So how do I do it? I thought medical field would be the right pathway to help and create some difference in people's life. So that is how I thought, okay, I should come into medical. But physiotherapy is not something that I knew. But my mother used to take a lot of physio sessions for her backache and all that.
Okay.
So I knew there is something like that, but I didn't know you can make a career out of it. So later, when we started, there was no NEET and all that. So individual exams for colleges used to be there. So, and of course, other reasons I didn't get my MBBS seat. So I thought, why not try for something else? So when I went into my UG college for counseling, I was offered from BDS. So then I saw physiotherapy.
Okay.
And I know that it has created a great change in my mother's life. So I thought, okay, why not try that?
Oh, so you got the seat of BDS, but yet
Yeah,
you changed your
I
mind
tuned.
to.
Yeah.
Wow, that's great. That's great.
So I can choose anything from BDS was the option. So I didn't want to give donation and all that and take a seat. So whatever was offered on merit, I wanted to take that. So from BDS, so I chose physiotherapy.
So as you said, it's counseling and merit. So you are a studious person back then in school. Is it?
No. No. Probably they had their cutoff very low.
We can put it in that way, but else everyone knows that as per look, you are a studious person.
Looks are very deceivious. You can't really say. No. But yeah, I don't know. And in 11th and 12th was quite average for me. I was not great studious and all. little average only, but yeah, I was the thing that merit la dhaan pogano. That was there, so I didn't want any donation seat and all that.
So
Yeah.
back in 2014 time, your mother
2015.
15 time, your mother were already taking physios.
So that when I was very small, in my childhood. So I am a cesarean child. So because of cesarean section, C-section, you have all this back aches and everything.
Abdominal weakness.
Yes, all that. So she used to take therapies back then. So that's when I came to know, okay, there's something like this.
That's cool. So then you got the seat,
Yeah.
joined in physiotherapy. So how was your first year, second year, and experience in college?
College experience. So
It was a physiotherapy college or it's a medical college?
medical college.
Oh, it was a
medical college. So part was physiotherapy. So we used to have proper strict timings and all that, and full classes. We were 100 in class.
Wow.
So first year was very nice. I loved anatomy. That's the basis, you know that. I loved anatomy. I hated physiology.
I loved physiology.
I love anatomy even now.
Okay.
It's very, I feel it's very like you keep digging. It's very curious. Anatomy is for me. So first year was nice. I had good batchmates and we used to study together. I was in college hostel and we used to study there together. It was very nice. Post first year I moved out because of the restrictions and all that. So because my house is in Chennai and the college is also in Chennai. So there was a restriction to traveling home. So I thought I should not have that restriction because it's my home. So that's why I moved out. But lectures and all that was, yeah, okay. What you expect in first year of college, you that college thing, no, that's there. So you just want to while away some time. But anatomy, yeah, that I was very serious when I was reading anatomy. Rest all was just whiling away.
Back when in first year, yeah, anatomy, which is a subject, but for me it was too much confusing. So,
Right.
but when with physiology, when we learn about the system and all, I was like so curious. So I used to score physiology a lot rather than anatomy.
Okay.
But in semester exam at finals, I scored too much mark in anatomy, very low on physiology. Even I wasn't expecting.
Situation changed.
So how the second year, third? So till second year, you were like reading the subjects like.
Yeah, normally. So second year was when, so I'm interested in research as well. So second year was when I was introduced by one of my professors to this research posters.
Wow.
So there was this international conferences that keep coming. So second year to third year, that time is when she started introducing me to all this. Initially I told her I won't do all this because it's too much of work. So you have to do some research in a pilot way and then you have to put it up in a poster and then you have to go present.
That too in second year.
Yeah, second year, third year like that.
Wow.
So that was my first experience. So I was like, no, I'm not going to do it because it's too much of pressure and all that. But she motivated me a lot. So along with me, there was one other person who did it. So he was my classmate. So we both, he did his poster, I did mine. So that is when we went out of the college and we presented our posters, and the first time I got second prize.
Wow.
I was so happy.
What was the topic of the poster?
Topic was on hyperkyphosis in elderly.
That too in second year, third year.
Yeah.
Wow. So you were doing it like an observational type or it's
Yeah,
an
it's an
interventional
no, it was an observational
Observational
study.
type.
It was a pilot. So we just presented that in a poster. My school friend helped me to design the poster and all that. So major credit goes to him also for designing. So
Back
yeah.
me when I was in second year, I was like, we were deciding whether we should buy Dominoes or else how to manage classes.
Don't portray me so studious. I'm not.
we were also, but when I was in second year, I was not interested or I was not looked research or anything
Right,
because
right,
I thought myself, okay, still I'm a kid. Still third year, final year, acha, that time we will do it, but not now.
Yeah. I have to give it out to my professors and my batchmates as well.
Oh.
So you know that environment is being created where you try something. So they give you that opportunity. That's more important, I felt.
That's true. That's
Yeah. So that's when I got introduced to a lot of people over there in the conference. So a lot of talks about this community and all that, about physiotherapy being useful as a service in itself. So that is where it all started about actually materializing my thoughts of doing service to the community. So I met a lot of people, spoke to them, people who were pursuing community itself, community physiotherapy itself. So I thought, okay, right, what I wanted, I can make actually a career out of it. So on the second year, third year, that time is when it started. Third year, we had this community rehab. Community medicine.
Community medicine.
Yeah,
Preventive and social medicine.
exactly. So that is when started reading on it, and I came to know there is community physiotherapy as an elective in PG. So because we don't know, you have ortho, neuro, cardio, pediatrics, sports. This is the maximum.
Exactly.
Community physiotherapy being an elective and a career out of it started in third year exactly.
The two a specialty, a major
Exactly,
specialty.
as a specialist. So you're called a community physiotherapist. So being called like that was something new. So third year is when that understanding of be making it a career started. So before that it was just a thought. It didn't materialize. So that's when it started, and I had my own professor who did his specialization in community physiotherapy.
Cool.
So he used to tell me on how this works and all that. But I never had an idea because he also was only a professor. He didn't really go out on the field and work much except
was
his
into
initial
academics.
days. Yeah, I was more into academics and research and all that. So an exact understanding of community, even now, it's not there because it's so much. I'm just 1 year into the job, so it's so much. So yeah, third year is when it actually materialized.
So as you were mentioned about conference and thing.
Yeah.
So when I hope many of them can able to relate to me as well that when we were in college, if it's a conference, we do poster presentation and so on, but it's more like get together.
Yeah, it's
you
fun.
guys can enjoy fun
Yeah.
and culturals will be there and so on. But now as after completing physiotherapy, now I'm once the graduation done, being a guest for a conference and going to several conferences as a guest and as a participant, now I can able to feel conference is the very best place to interact with numerous people who comes out of numerous niches of physiotherapy.
That's true.
And that understanding hit me back 2 years back only, because when it was there in colleges, I thought it's like a program. We'll do it's like a competition and it's like a sports day or
You're
any
out
other
of
day.
college for some time.
Yeah, exactly. For 2 to 3 days, you can enjoy yourself. So with your friends, having some fun.
Exactly.
So that was it. Eat great food
Yeah,
with a
free
great
food.
spread.
You pay, but
Yeah, but
still.
It depends
Yeah.
upon how many guest speakers are coming.
Yeah.
So we have to pay, but yet we really enjoy that
Yeah,
conversation of having
yeah.
there, right? So it was into that. So third year and final year, I wasn't even joined one conference at all. In my entire UG life, I think I haven't joined any conferences, any workshops, nothing, because I thought it was like a fun thing. Why I should join and pay XYZ of money in order to do these things. But I just feel in college time we attended 1 or 2 workshops which be done in college itself, right? So that was a great time for again enjoy
True, yeah.
great food, great spread,
Yeah,
with
right.
great fun with classes, classmates and so on. But after graduation only, like when you sit in the last rows and final rows and mid rows, that understanding was different.
Right.
But when you sit in a first row or a second row and you look and your view at the conference was completely different. So nowadays I'm enjoying conference because you don't know how many people are into physiotherapy and how many niches are into physiotherapy, and it was really great. But I just feel students need to understand that.
Yeah, true.
Yeah, because when I was a student, I really felt the same.
No, it will not come. No, we can't expect the students also to understand so soon, because at that even I was sitting back. My interaction was with the people who came to the conference rather than the topic and the guest. I used to come late, sit back, sleep, go. Hardly knew nothing what was happening. But when people are sitting around you, you talk to them. Even if the conversation starts on food, you will some way slide in conversations with physiotherapy because you both are in the field and you both are students or probably a speaker something or somebody you have like. So I had met this Dr. Dean, the cardio book writer.
Cash.
Yeah. So she had come to one of the conference. So I had met her. So like that, you read book and your authors come and then you meet them. So that is like just for the inspiring part. Oh yeah, I'm meeting them and all that. But actually, knowledge sharing and all, it will happen later. So in student age, they are not. Nobody's interested. In even now, if I'll go. I'll probably, okay, maybe I will choose, but if at all I'm still in college or something and I'm going, I will not probably concentrate. I would more look at people around. So yeah, it's expecting that from students is little not practical, but probably we can tell them that you can interact with people around instead of just going and coming back, or probably not going only or sleeping somewhere
or
you
eating,
can
just
yeah,
enjoying.
you can interact with people around you who are also delegates over there, who are also people who are attending the conference. So it need not be academic interaction. It can be a normal interaction. So you get nice, good contacts. You establish a nice, a socialization that's happening, and then you support each other later. Even now, I have my friend who is a very good influencer on Instagram and all that. So when I get some people who are, she's a nice clinician. So when I get people who need, I don't have a clinic, so I don't have those equipments and all that to take care. So I send patients to her. So it is all that give and take that happens within. So all those gets established in when you go to such places.
True.
So that probably students can do. Because I think only 1% of students would probably go sit and actually listen. It's actually beneficial.
True.
But a very small population. What the other population can do is probably make that networking, which is very important nowadays.
Yes, very important. And also, I would suggest rather like for short networking, along with it, at least look at the first few slides of the guest speakers who are coming.
Right.
To be specific, what was the topic? And whether you knew about the topic, or else you can read about it. That was the one way.
Right.
Or else the qualifications what they have. That will tell you like, oh my goodness, there are many things which we can do as well. Because
Right.
once we are done with physiotherapy, we don't know what to do. But when you look at someone's qualifications, which has been viewed on the stage, it was numerous, which goes 3 to 4 lines.
Right.
At least one will definitely inspire you, and you can able to learn something from them. So for sure, yes, of course, 90% it would be little bit time consuming and
Right,
boring. We
yeah.
may not able to concentrate. But I would suggest everyone to just at least look at the guest speakers qualifications and what they do and the topic at least minimum. Otherwise, you have to give yourself in order to read.
That's true.
Because as she mentioned, in third year when your professor and someone inspired you, you got a career out of it, which how many, I don't know, more than 50% of physio population might not know about it.
That's
right.
true. That's true. Yeah.
So that is very important.
Yeah.
And conferences really make that connection.
Yeah, true. That's very true. Very true. Yeah.
So in second year and third year, what is your favorite subject?
second year whole second year went off in proper sleeping and all that. I'll not deny.
Okay.
My friends would be watching. They might watch. So I will not deny. We used to take pictures of sleeping in the last bench and all. So, but I think the nice part was labs probably. Exercise therapy lab and all that. Where we were angry for standing the whole day. Probably the whole 2 hours or something. But
I thought it was only happened in mine.
no, it's there everywhere. But that develops the patience, I felt. Now I'm feeling it. That time I was very angry.
For me, it was not angry. It felt like why I should stand
Exactly.
for the
It was very
entire
irritating.
class.
Being a girl, a few other things when slides in. So on those days you're not ready to stand, but your staff being a female doesn't understand. You feel very frustrated. But that is something that get compromised when you're in work and all.
Yeah.
So I think it's a foundation from there.
True. Even when I was in college, when the exercise therapy, throughout the class we have to stand. And even I thought like, why should we stand? We can sit and listen or we can sit and see. But now I can able to understand, because when you're having a conversation with patient in the bed, or else when you are treating a patient, you should stand.
Right.
Because they are actually sculpting us from the earlier stages. Now we don't feel any leg pain or something.
It's not a big thing. To stand or 2 hours.
no
Okay.
problem.
Half a day, fine.
we can
Not a
able
big deal.
to, we can able to pull it up till one day also.
That's the spark. From
Yeah,
there
true,
only it
true.
started.
Yeah,
So
but we haven't understood that part. That time we were just
do not expect only to understand. Very naive we are at that time. Very immature. Very naive. You just want to be relaxed. College, come finish, go. This is like it's it's different compared to other streams. Medical field in itself, all the medical field, all paramedics or whatever it is, everything. Because we carry a lot, like whatever we study, we carry throughout our career. Maybe not, probably other careers don't really do that to the extent that we are doing, but we carry a lot. So we have to, at that time, we have to have that thing, but we don't have it because everybody's mindset is like college. You just want to chill.
chill.
Yeah, it comes later.
Very true. So in third year, your favorite subject was
Second year, third year community.
community only. It's your
Yeah,
favorite subject.
any day.
So how was the final year? That reality part.
Oh, final year was very hectic because final year we had our project, final year thesis were there, and we had 8 subjects nearly. I think 7 to 8 subjects. So all PT subjects, and then we had the community physio, then we had rehab, then we had ethics. Ethics was part of, I think, something I don't remember right now. So there were multiple things. So it was
Along
very
with
hectic along with
the
thesis.
research.
Yeah. So it was very very hectic. So final year went off in the thesis only.
What was your topic?
My topic was you're asking. I'm trying to remember what was
Like
my
even
topic.
you don't have to tell the full topic.
No, I don't remember only. Oh, how did I even forget?
Can I help
actually no. I actually don't remember what was my topic. What did I do?
Okay, it's fine. We'll decide that.
Yeah.
We will put it over here, guys, somewhere.
It'll come down. I don't remember. What
So,
did I
like,
do?
after the thesis part in the final year, you decided you wanted to.
Oh yeah, I remember now. Thank God. Because my mother was one of the, she was part of the thing. So was that my thesis? So I did research also. So why the confusion is, so in the college that I did UG, we have research days that we celebrate. Okay. So we try and present research papers on those research. No, every year it happens. So you can start doing. You can do two people together, or you can do individual also. So at that time, because of this one professor who introduced me into the research thing and all that, I found an interest in that and I started doing it. So I had done multiple papers. That is why I don't remember what was my UG thesis.
Yeah. In UG itself, we were doing researches. You
Yeah,
were
yeah,
part
I
of many
started.
researches.
Yeah, I started doing. So I did one systematic review. So systematic review came later. I did an observation. That was an observation study in second year, third year, which I did. And then one intervention study that where my mother was one of the subjects. So I took the problem that my mother faced, and it was about the hand. It was about hand rehab. So I started searching literature on that, and then started learning on what is research and how do you do all this, what is statistics, because you don't know all that in third year. Nobody will make you sit and teach A to Z. A guide will only guide.
For those who doesn't know, we do.
Sliding in swiftly,
Yeah, just making everyone to notice, but not to notice.
Okay, that time you were not there.
Yeah, we can say that probably. Yeah.
So, but the guide did help me. But they don't catch your hand and they don't make you do things. And I am also not that I'll go ask every single thing. I'm like, you have Google, you have internet at your hands. It's at your disposal. Go and learn. You have that capacity to learn. We all have the capacity to learn. Why don't we try it? So I went and started learning and how to do, what are the different kinds of studies and all that. So
It
that
was in
is
third year, final year.
Yeah, third year, final year time. So that is why I don't remember my study, because third year I did one research. Final year I had 2 researches. One I did alone, the systematic review. One more I did with my classmate. So that was on cancer. That's why I don't remember my thesis.
Goodness. So, like, as we were speaking about research and thesis, can you just give them some ideas how to learn a research, where to choose?
So I learned it the hard way. So the best way to learn would be, I think now colleges are having a paper on research and biostatistics, because my UG, when I did my UG, it was not there. My PG only had. So if you feel like, you should start with an observational study, I feel. So a very basic thing would be an observational study. Something too tiring would be a systematic
and meta-analysis.
Yeah, that would be too tiring. I didn't do meta-analysis. I did only systematic review.
I did meta-analysis and systematic
Meta-analysis
review
is
too.
very, very difficult.
I spent
No, my topic didn't require the purpose of meta-analysis. So understand the basic research. So you have in your college itself, need not spend and all. That thing comes later when you feel that, okay, this is interesting. I feel that this is nice. Not about the theory part, just the basic understanding of what a research is. Why do you need to do a research? What all it involves? So when you understand that, so after that, probably they can join some courses or something like some certification courses or any.
Is it available?
I think so. I'm not really sure. I think ICMR and all this have, but I'm not really sure about it. They can join you. No, I have slided it in.
We'll drop it everywhere, wherever we can.
Possible. So yeah, many people are teaching. So they can choose their tutor wherever they want to, whomever they feel comfortable with. So they can start learning. So I learned it post UG. I wanted to properly learn, so I learned it from one of my senior. He's organizing some learnings. So I learned it from one of the classes from him. So it was a 1 month proper course. So like that. And then if you really want, the basics and you really want to do something, start from a problem that you are seeing in your day-to-day patients. Something that you're seeing but you don't have an answer for it, or you want to analyze what exactly it is. It can be as simple as a literature review also. Even that is research.
Yeah, it is.
So you have to learn how to choose papers also. That is also there. So that is the process of learning that you do. So when you are trying to understand, trying to find a problem, or trying to analyze something, that is where research starts. That is a basic form of research. So that is observation. That is a literature. So you start doing that, you accumulate papers, you understand that, okay, this is what the literature says, this is what is happening, but I need to find some relation, or I need to understand that why is this happening, or anything like that. So that is when you can start to explain the literature and write a review. Later you can do it as an observational study. So when you're doing it as an observational study, so it's a process. Do it as an observational study and try and observe the variables, what's happening and all that around whatever condition you have taken, or around whatever population you have taken. And then you identify the exact thing of why, or you got an answer for whatever you're looking for. So what can you do for that answer? So that's when your experimental studies and all that come into play. So could you do something, or is it ending there? No research ends. There is scope for doing more and more in it any day. Saturation happens when you don't know what it is.
It is, exactly.
You don't know. It's not actually saturated. You just have not probably seen that dimension or perspective. So when you start, and then use this networking with people and all that, talk to people who are more into whatever you want to observe or whatever you have derived out of it. They will give you more perspectives. And then again back to the literature, what it says. So can you do something to solve that, or to handle whatever you have observed? This is very general, I'm telling. So that is when experimental studies come in. Or do you want to, you don't have a tool to actually analyze what you have observed. So that is when all this trials of creating questionnaires and all that, outcome measures and all that come in. But that's very,
very
big.
when we, yeah,
that's very big study. But this observations can be started off with.
Yeah, observational studies are go-to for anyone who wants to
started
start
off
with.
Not even clinical trials.
Yes.
General observational studies. You have
what is your thought on case studies? Case studies also is
you can do case studies. So there is this you have single case studies and then you have case reports, right? So basically to say in general, you have qualitative and quantitative studies. Okay, so in qualitative studies is where it involves a lot of narrative reviews. So you have things like so my research that I did in 4th year, like for the research day, so it was a qualitative study. It was an interview method. So I just took 5 people and I interviewed about their quality of life on urogenital cancers.
Okay.
So I had my friend who had to interpret all that and write. So we were doing it together. So that gave an insight into a development of a questionnaire later. I've not gone into that. So you don't know. So how will you develop a questionnaire? To analyze the quality of life, you need to know that they're suffering from all this. Where do you get that information from? You need to ask the people who are actually suffering from it. And how do you get what you need to ask? Before that, literature review. So you read on what's happening, and then there's a review that is there. So you have a broader perspective of, okay, this population is going through all this. And then what exactly the experiences are, you do a qualitative study, and then you understand their experiences, you comprehend both, and then you write a review. So that is how the qualitative studies work. And then putting this into numbers, putting this into actual impact on the society, datas and all that, that's where quantitative comes in. You have mixed methods also where you do qualitative, quantitative, where you cannot really, quantitate certain data, where you bring in the impact of the data through qualitative analysis.
But it is tough in the earlier
stages. It is tough, it is difficult, it is all later. So to begin with, qualitative studies would be the best things to begin with. So, and on top of that, if you are not able to write, it's okay. If you're only interested in research, one more important thing that everybody needs to remember is research involves a lot of people. You cannot do alone. You do alone, you restrict perspectives. You have many people as in not really many, you have people who actually can contribute qualitatively, good quality contribution. You have 2-3 people, they give you perspectives, they bring in a lot of good things. So that will make the study even more better.
For that, we need to select correct people.
Sorry?
Correct people.
Yeah, right, that's true. And this thing of being the first author, second author is always a problem in our country. Don't worry. It's not important. You're the first author, you're the second author, you're the last author. No. Study is important. You being an author is important. Any study you are, any author you are, you will any day be the author only. First author, second author, that's not important. So yeah, students need to understand that I have to do the research all by myself and I need to be the first author. That's not required. So you can probably 2-3 people can collaborate together along with your staff. Very important that you have a guide.
True mentor.
Very, very important. So along with them, and you start with a basic literature review, a basic narrative review, write it off. Give it for a lot of reviews. People around you review. People who have, done a lot of qualitative studies review and then give you feedback. Take the feedback. Very important. Take the feedback. Redo the work. Because you go to a journal, it's not easy to publish. It's never easy. I have 5 studies that I have not published. 5-6 studies sitting in my laptop. Because you have to rewrite them. You have to find the right journal. You have to find the journal with good impact factor. Impact factor is very important. You can't simply publish studies just for the sake of publishing it. You have not done research just for the sake of doing it. So if you're done with a purpose, then publish it in a proper journal.
Because in people who know about research, they can easily qualify our publications or our research paper, whether it is good or not, or we did very average. So when we did it very good or when we did it really great, then the opposite person who already know about research will get a great impact. Okay, they do know what they were doing. Otherwise, we can just do it like, okay, acha, I wanted to do something, or let me do something.
Right.
Because by looking at research, we can able to tell how quality it was, how much effort they have given into it.
True. And also, it's not like you have to publish in journals like only Nature and all. So Nature is, for those who don't know, Nature is so they reject 99% of the articles. So something is on Nature, that means it's amazing. But that doesn't mean you have to, you aim for it. But you can, there are even more good journals, lot of Scopus Index journals are there. You can still publish there. Aim for Nature, later stages of life. Now, if you're taking research into a career, you want to start with it, do a good research, do an honest research. Do not, force the data and all that. Do it very, very honest. Negative results can be accepted. Okay, the acceptance of negative results even in journals is really less. But negative results are good to publish because, for example, if I have to say, we read indications and contraindications for a particular method.
Disease.
How do you know? No, for our therapy, I'm saying. How do you know that is contraindicated for this therapy?
Until we are not
somebody somewhere gave it and they had a negative result and that's how it came. or they understood the physiology behind it. It was a negative answer that for this you should not give this. You should not is always negative for everybody. So that is how
you are
it
doing
came.
something so that we
Exactly.
can give an impact to our upcoming people or to our community.
Exactly.
Whether
Yeah.
it can be used or not
Cannot
can be
be
used.
Yeah,
That's
that
true.
is
also
also a
equally
study.
important.
Yeah, that is very important. So don't worry that you're getting negative results or anything. Negative results are very important, as important as
the
positive
positive.
results, because you know, okay, this is not working, or this is not good for this. I got this result. This is not working for this. So the whole speculation behind, so you have this hypothesis, right? So hypothesis is like, you think about, you have a question in your mind and you think like, okay, this could be because of this, or this could affect this, or this could cure this, something like that. Okay, or this could be a beneficial therapy or something like that. So that question is solved. That's not helping. Not helping because of, actually it's not helping, or not helping because of other errors in the study. It could be anything. So any day it's a knowledge. Any day it's beneficial for somebody who's going to take this topic again.
True.
So negative results are also appreciated. So going into research, be ready for negatives. That's more important. Yeah.
So first, find a right people who are also
True.
equally interested in research.
Very true, very true.
Because when we need to have a people in our team or something, so if we are selecting someone who just want to do it for the sake of doing it, and it ruin the entire mood of doing a research, because research is a long shot.
Yeah.
Yes, right. So we need to have good mindseted people who are equally important, along with good guide. Why? Because guide, I just feel important. When we are coming up with topics or anything, we don't know how it works and what was the reality, because we were still not experienced into the practicality of the society.
Right.
Okay,
Right.
but the guide already there. So they know what is the practicality. So they will tell us.
I mean, they are guide for a purpose.
True.
So we need to understand that guide will not hold your hand and move through. They will show you the pathway. You have to walk. It's you who has to decide to walk or not. So they will help you finding the right path, because we being very naive and immature in the sense, in the field I'm saying. So when you are like that, you have multiple pathways. So you don't know which could be the right ones. So they will give you a perspective as to these paths could be right. Now you choose which is right. They will not exactly also show that, okay, you have 5, you go in this one. No, that would be spoon feeding. That is not any guide would not do that. So the pathway, they will show you that, okay, these could be good. This is not good for these reasons. So you choose what you want to do. Any day it's your choice. That would be the best guiding.
True.
So yeah.
And after that, we can, like, anyone can do research if they have an interest.
Yeah,
but in
sure.
UG life, as you can able to see, it is really important. If you are interested, please do from your UG life itself, because it can give you a perspective that majority of people don't have. Because I just personally feel, and I constantly say that to my students, that you should showcase your skill. And you should stand out of the crowd, because we are a big population.
True.
But many people doesn't aware of it. We
true.
are a very big population, so we have to do certain things so that we can able to make out of the crowd.
Right.
So that we can be very visible for many opportunities.
Yeah, true.
So doing researches, learning about research is one of the key aspects which give you a thought process, which majority of the physios don't have.
And there's something called evidence-based practice.
True.
Very important. How do you know this evidence is going to suit your practice? Comes with research. When you're into research, and when you understand how to select a paper, so how do you select an evidence? So you need to know if that particular study or the particular paper you're selecting is applicable for your patient. Before that, it is actually a good study or not. So how do you do all this? Those metrics you develop when you're into research. So research being an important part is, a lot of people don't recognize, thinking it's very tiring. But you need not do a research, but at least understand the metrics of selecting. So you apply that into an evidence-based practice, you're any day a better clinician. Any day you're a better clinician, because you're doing evidence-based practice. And you can quantify your results to the patient. So a lot of therapists who my own friends or other therapists who I'm seeing, I can see visible differences in their practices when they do evidence-based practice.
Because which is constantly evolving.
Exactly, and they say I can promise you that you will be this much percentage all right with whatever complaint you have come in 5 days. And they do it because it's evidence based. I know I exactly have spotted out your problem, and I have the evidence of a perfectly right evidence. So I'm going to create a change. I know that, and I work in this manner. I know that's the change that's going to come. We will also tell them that okay, for it not to come, we have other factors. So that kind of a clear explanation to a patient you give, and the patient trusts you and comes back to you. Because either all this word of mouth only. How much ever you advertise, you do all that. Word of mouth is very important, and it's very fast way of marketing. So that happens when you give you have that knowledge and you give exactly that to the patient. You need not beat around the bush. You just tell them that okay, this is your problem. I've sorted out this. But this could be cured in so many days. This is the pathway we need to follow. If at all you're not getting the desired results, these all could be the reasons. So for that also we have plans. So you give this wholesome picture to them. Why will they not come to you? You have to develop your skills.
True.
You develop your skills.
In order
Don't say
to
that they will
communicate.
not come.
Yeah.
You develop your skills to have the knowledge to communicate. That's more important.
In Western countries, as I work with many people around the world, so in Western countries, before giving you a treatment, a week prior, they will make a consultation or a booking, let's say, Wednesday, so and so time, you and the patient will meet. So 1 week before, you have to give that, okay, this is the topic that we're going to discuss about. And whenever listening to them, it was like so different than what we practice in India, because we have to tell them what we're going to discuss about to the patient. It's not like okay, they're going to come, you're going to reveal something which they weren't expecting at all. So you have to tell them what we're going to discuss about, and if you are planning to give a certain type of exercise or certain type of treatment protocol, you're going to explain them, we're going to practice that, we're going to do this with the proper evidence-based research attached to that mail.
Correct.
Which is given to the patient. So the patient will read the research, the patient and the therapist is going to talk about, and what was the treatment is about. Once they are convinced, they will reply the mail, yeah, fine, and then only they will confirm the booking.
Right.
Otherwise, they don't even confirm the booking. In our society right now, the patient will come if we explain them, and if they believe us real well, which is very, very important. The placebo effect needs to work. So if it is there and we can explain them, we can just sort that down in that minute itself. But in Western countries, in many Western countries, it's not the case that we have to explain. But actually, that evidence-based practice is really, really important, because it will open the gate which in your mind, that neuroplasticity gonna be curated in your brain, when you start evidence-based. Otherwise, you just stick on the strengthening, stretching, at the basics, which is equally important, but one way or the other, you have to grow, right?
True.
So evidence-based practice really important when it comes to the career-wise.
Yeah, communication is very important as well. How well you communicate what you know. So that's a process. So your choice of words, very, very important. In our country, we can't really expect, we have populations who don't really know what exactly we do as, so they have this pain. Most of them have an intention that, okay, you have pain, I want to reduce it without medicines. And then they come here. Great, good to start with. But the actual effect of it, how we go about it, that it's a process and they need to go back home and continue certain things. All this understanding is little less. I think it lies in our hands as well, because not to blame anybody, but a larger chunk of our professionals also don't do it that much. It's there. So, I have a clinic, you come, I just give you some modality and go. That's not something we should be doing, really. We have a greater responsibility, I feel. So somebody is trusting you and coming to you, and you can't simply say that, okay, I'll just give you this, you go, you just listen to what I'm saying. No, it doesn't work that way. There's something called consent as well. So you tell them exactly what is the problem and all that. It depends on where your clinic is placed. You're more towards semi-urban, rural areas.
Which tier 1, tier 2, tier 3, which city,
yeah,
which
all
area.
those, not really people are into listening. They're like, I think you've seen that joke. What is that movie that where they have this time machine and all. So he keeps explaining what is the problem with the mixie. She'll ask, "Odma odada." It's actually like that. They're like, can you cure or not?
Yeah.
So they don't have that patience to actually listen to what, because they are in so much of pain. You can't expect them to come and you keep telling them and they keep listening and then they take an informed decision. No, it doesn't work like that. So that's why I told communication is important. A choice of words is important. Make them realize, tell them that how important it is for them to go back. 100% don't do it. But yeah, they realize that they will definitely do it. So the attitude change in the people has to come when we take an effort. That will come when every physio out there takes that effort to create that attitude change in the patient that they are seeing. That one is enough. Need society அந்த அளவுக்குலாம் போக வேண்டாம். Just the patient that you are seeing, you try to change their attitude and mindset. That little extra effort,
It's more enough.
more than enough.
Like
That's
I
it,
would
yeah.
like to add one point as well, as we are discussing about the modalities, that now everyone jumping, not everyone jumping, everyone trying to portray themselves like we only do manual therapy. We don't even touch any electrotherapy at all. Why? Because it is just to tell that we are very much knowledgeable, as well as we are very well practiced in terms of our hands. And I'm agreeing the point of view, but my opinion towards this might be little different to many of them who were saying. I just feel using an electrotherapy is not a bad thing at all.
No, definitely not.
Yeah.
No, like now a patient walks in with a pain scale of 9 or 10. You can't go massage his back. You can't go do some tissue release. You can't go do all that. He is not going to allow you to touch, he or she. You just relieve that pain. You just give that effect superficially. A few modalities do have healing capacities. That is different. But to talk about superficial pain reduction and all that, you give it. It feels better. The pain little reduces. Then the patient allows you to touch, and then you create a difference. So it works hand in hand.
Exactly.
You cannot rely on one thing completely. It depends on the patient also who is coming to you. So you gauge the patient. You should have the skill basically. So it all boils down to the skill to be able to gauge what the patient needs. So does the patient needs a combination of modality and therapy and whatever hands-on you need to do, or any strengthening, stretching, or whatever it is, whatever other kinds of therapy that you're going to do, or do they need only this section, or this the first thing alone for a few days and then followed by this, or in the same session you do both. So that you have to gauge based on the patient. You cannot promise, in like how you told, you cannot say, okay, we are not going to touch all this. No, what will you do if I'm coming with 9? You'll keep doing all the release and everything, and I'm going to shout, I'm not going to let you touch. Apprehension.
Certain cases are like that.
Yeah, apprehension. I will not let you touch. I am in enormous pain. Just I myself had it. I had a very bad hamstring pull. If you come and do release for me at that time, I didn't even allow them to touch. For me, it was like 10. Of course, it was not 10. Being a physio, I know that. I felt it was 10. I perceived it like that. My pain threshold is very less. But then some kind of a massage, or, the IFT and all that, post that, some stretches I did. Then I felt a little fine, and then that is when post that they did the release and I felt great. So it's a process. So it depends entirely on the patient. So don't promise things as to this we won't do, that we won't do. No. You come, we'll do what's best for you. So it depends on the patient. That's it.
Yeah, because as I can able to see on many social media platforms or anything, yes, they are doing hands-on technique. I'm really happy for them, and I'm really looking them. Wow, it's a great deal you pulled out very well.
Right.
But at the same time, what the physios who are upcoming might think, okay, I should only do hands-on technique.
Right,
so if I'll touch in electrotherapy, maybe I'm not fitted to that standard.
Correct.
From my point of view, it's not like that. If you are taking an advantage of electrotherapy, it's great. It's your choice. It's your modality. It's your therapy way. So you can take an advantages of a modality. There is nothing wrong in it. So what might be wrong? Just if a patient comes with pain, if we are just relieving the pain just with a modality without even giving a rehab,
Right, exactly.
that
That is the thing
that
of
is the thing which
botheration,
we
yeah.
should be bothered of for sure.
Exactly, definitely.
Otherwise, if you are taking a modality as a part of your treatment protocol and
Right.
subsiding the pain or whatever the therapy you're gonna do, and you are adding along with the proper rehab protocol to make sure that you are not only treating the cause, you are you are solving the problem.
Exactly. That's
Okay,
right.
so if you are doing that by using an electrotherapy, which is great.
True.
So don't think hands-on technique is
The only way.
the only
Right.
way.
True.
Okay, so we have an electrotherapy subject. We still do. We still read. Everyone
Right,
do.
right,
So
right.
we are learning about
You have
these.
to understand the limitations of everything.
Exactly.
Everything has limitations.
Yeah.
So work in those limitations.
Yeah,
That's it.
yeah.
Very
And
simple.
patient to patient, it differs as well.
Exactly.
So
Yeah, yeah.
one can be happy with having a modality. Yes,
So
to
it's more than happy, like what you want to, like you
outcome
told,
you-
cure it. Yeah.
the outcome what you expect.
Outcome.
That is really
Exactly.
matters.
Yeah. You cannot achieve functional abilities with electrotherapy.
Yeah,
You cannot reduce the pain, like depends on
On
what
the
kind of a
pain.
pain it is, just with hands on. So it depends on what are you achieving at. Depends on what the patient wants, what you actually want to give, coincide the goals, and then try and understand what you want to give to the patient. So yeah, that is something that comes with practice.
But the summation really matters, that we
Yeah.
are adding many things to make sure that the
True,
end
true.
process needs to be for
Yeah.
the customized and tailor made.
Correct.
It is not like, okay, I bought this 1, 2, 3. So any patients come with this. I'm
1, 2,
going to
3 and chip coffee. That's true.
That is wrong. That
Yeah.
is bad.
Yeah.
At the same time, okay, I have this 1 or 2 to 3 hands-on technique, and my team, or let us say my thing which we only do, we are specialized in this one hands-on technique, so we're going to only do that hands-on technique.
That's true.
It's great if you pulled it again. But again, for upcoming physios, don't only think, okay, one is more enough to do with.
Right.
You can summate yourself which is going to work for you. For me,
Correct.
to be specific, electrotherapy works really well for me.
Yeah.
For
Right,
me,
right,
really
right.
work very well, because as I was working in an hospital, it is a mandatory process, because I cannot able to give my time as a consultant physiotherapist for a longer duration to any one particular patient, because I have a shift basis.
Right.
Okay? And I have physios who work in order the treatment protocol as well.
Right.
But when I have the advantages of electrotherapy, which really helped us to reduce their pain, along with to work other things as well. So we do hands-on, we do electro together, along with the protocol, with the rehab protocol, tailor-made based on their need, which really worked for us.
Correct.
So that is fine. Manual therapy, great. That doesn't mean electrotherapy is bad. It's all about how you are using it.
Yeah, right. Of course. Depends on who comes to you. Yeah, that's right.
So after physiotherapy, after 4 years, after you have your research and you already made your mind that, okay, I feel community physiotherapy might be more interesting for me, because you are already oriented to more of service.
Right,
So
yeah.
after final year, have you practiced or?
No, I didn't practice. So that time was COVID. So 2020 I'm talking about. So 2020 March I had finished my UG.
March 19, the COVID first
Exactly.
hit happened.
3 days before that I finished my internship. Very lucky to
Lucky
finish.
kid.
One among the lucky in my batch. So, but unfortunately my PG got pushed away to November like that. So, so I did my PG in Bangalore. That was again a medical college. She'll definitely say, even now she says, Mom, I've never seen you get up in the morning and study.
You were attended my morning session every
No, I
day.
did,
Okay.
but I think that was the only time.
So lucky me.
Right. I wanted to learn also.
So
50-50.
yeah, it is.
So yeah, he suggested me 2 colleges. I applied both. One I was sure I won't get. The second one was where I did my PG. So I was very sure I will not give any donation and all that. But for once I had this thing that who will take community? Very less people will take. So I will anyhow get the seat. I had the thing on my mind. Okay. I'm being very honest. Okay. So I was also the only PG in my college who took community. I had seniors. I had even my immediate senior was only 1. Her seniors were 3 people. My juniors were 4 people. But we both were only one in our own classes. So I applied online, as in forms and all that. So in that they had asked about if you have done any researches, mention all that, and what are your other experiences, conferences, all that. Mentioned all that and sent them. And then I had an interview, online interview. So 2 of the staffs had taken. So post that I got a mail that you've been selected and all that. So I was very happy. Before that I decided to join in my UG college itself, because I was thinking COVID and all that, what will I go to? I didn't in Bangalore. So what will I go to Bangalore? So I thought, okay, I'll be here only. But luckily I got it. So my mother and my father, they had so I gave it to them. So you decide, should I go there or not? So my mother knew from the beginning that this is something different and she has to get this in a best place. So she's able to make a career out of it. So I have to give it out to my family for a great support even now for all that I'm doing. Without them, I cannot do even 1% of what I'm doing right now. So my mother suggested that okay, you go to Bangalore and do it. So that's how I entered. And when I went there, I came to know that I'm the only one who has taken this. I was like, okay, what am I going to do?
You were the only person in the
Only person. We were
department.
20.
Okay.
20 of us in the class. So all other electives had like 5, 2, 3. I think the only elective which had 3 were peds, I guess. Rest all had 5, 5. So I was the only person who took community.
Okay.
So first year we all attended classes together.
Everything is.
Yeah. Second year onwards it's elective.
Elective.
So one-on-one classes. So
It was a great opportunity, right? You were like only one people.
One-on-one is scary also. Everything falls on you. So PG, like, probably I can take this opportunity to tell this. I've seen your podcast also on why you need to do masters and all that. I would like to add on a point. I didn't see it fully. Sorry.
It's fine. It's fine.
So I don't know. If
I
this
do
was
know that you
mentioned.
will watch this fully.
I will watch this. Make sure everybody watches also. But I don't know if this was mentioned there. But many people come and ask why we need to do masters and all that. Now I realize the need for masters is it depends on the individual. So a master's will give you a perspective of, it will help you develop skills for clinical, skills for research, skills for teaching. You already have those skills, don't do masters. So masters is like, all this evidence selecting, how to select research papers, how to go about all this, how do you actually communication skills, pressure handling situations. My PG was next level pressure. We were told that you will be put under pressure. That's how we worked. I've sat
I
in
do believe that when we are under a pressure,
we work better. I cracked badly. I cracked really badly. No, I did. So I had some personal things also going on, my health and all that. I got COVID. So some personal things going on. So all that happening, I cracked really badly. So, but masters will help you all that. You already have developed those skills. It's not required. You need not think of it. But if you're thinking like academically, I think you told that in your podcast, thinking of that academically, professor and all that, you need masters. But for a clinician, for a research and all that, but now sadly we're looking at people who are having qualifications rather than are they actually having that skill. So for the namesake, maybe it's required. But for the skill, if you have developed the skill, if you are, very good enough to have developed the skill in your UG itself, you will shine after UG. You need not go into masters like you. No, I have slided it in.
dropping
Dropping it everywhere.
back to back.
Yeah.